Well, as someone who has survived breast cancer, I can tell you it's never far from my mind. But for most, it's just not a pressing matter to think about, which is why we have October as Breast Cancer Awareness Month, a time for everyone to pay attention to their breast health and make it a habit 365 days a year. So for a brush up on what you need to know, we're turning today to the experts at Zangmeister Cancer Center. And Dr. Jeanna Knoble with the Zangmeister Cancer Center, board certified in oncology and hematology, joining me now. I want to thank you so much for spending time with us today.
Thanks for having me.
All right, so Breast Cancer Awareness Month. I just marked my 10 years this past April, so I'm always happy to talk about it and to bring awareness. Let's start by talking about some basic risk factors for people, though.
Right. So a lot of the risk factors really aren't modifiable, so being female and getting older. Now, men are not immune. Like, I think the statistics are 1 in 83 men, but 1 in 8 women, right? So those factors are probably the biggest. A woman's reproductive history. So if she's not had children, that's actually a little bit higher risk. And then there's like the actual modifiable risk factors like obesity and alcohol use. And then, of course, family history, genetics, inherited breast cancer is actually only about 5 to 10% of breast cancer. But that is something that if you have a strong family history, you're going to want to be, looking out a bit closer.
Right. Gives you that kind of heads up almost, that you should be paying more attention. Let's talk about some of the most obvious symptoms. I know for myself, it was a lump, which many women know to look for. But what are some other things we should kind of be aware of?
Correct. Yeah. So like you mentioned, a lump, pain, skin changes like inflammation or redness that doesn't get better. You can have nipple discharge or nipple retraction, changes in the breast like that. A lot of women don't have symptoms, though, and that's kind of points out the importance of mammography screenings,
And we know the magic age, they kind of say 40 for mammograms. But when should women start to do self-exams? At what age should they really start paying attention? Because I'm a big advocate for, it's never too soon, because I was 27. So is that something all women should be aware of?
Yes, I think so. I mean, I think, obviously I see a lot of cases, so I may be biased, but I think, if a woman sees something that feels different, it's a change, get it looked into. There's no harm in that,
You mentioned some risk factors that you called modifiable. So are there ways we can prevent maybe breast cancer, looking ahead when we get older? What can we do now?
Right. So there's limits to that. I think a big one would be the genetics, so if you have a family history, getting tested, and if you were to have a gene like the BRCA1 or 2 gene, there are things you could do like high risk screenings, getting MRIs, or having prophylactic surgery to prevent that cancer.
So let's get into treatment then, doctor. What are some of the treatments you do? And then we'll talk about, there's actually been some advancements in that, right? So what's typical? And then we'll get into the advanced ones.
Right. And there's a lot of individuality to breast cancer, and I think in cancer in general, so really individualizing a patient's care. So, a patient gets diagnosed, she has a biopsy. In our practice, we collaborate with other specialty doctors, surgeons, radiation doctors, pathologists, genetics, and we come up with kind of a game plan, right? So there are some patients based on the biology of their tumor where we might give them treatment before they go to surgery. There are other patients where we may just go right to surgery, and that may be it. Chemotherapy is something that's been around for a while and still has a role, but we're trying to get away from chemo to a degree. And we're finding that by looking at a woman's actual DNA of her cancer, we can kind of figure out which patients are high risk and really need that chemotherapy. Many may not. And that allows us to do less care, but have equal outcomes, which I think is great. We're also getting more targeted treatments. So, when you think about traditional chemotherapy, it's kind of, archaic in a way because it's killing all cells, right? So that's where those side effects like hair loss, vomiting, those, horrible things we hear about. But if we can, target just the cancer cell and kind of hone in on a receptor to that cancer cell, we can have less side effects and, equal or better efficacy in terms of how well the treatment works. So that's a big area of research and investigation.
And you mentioned those going through maybe the typical, maybe the new one. There are still a lot of side effects and people need a lot of support. So what at Zangmeister Center do you guys do to kind of treat that person as they're going through the journey and the different stages that they're going to face?
Right. That's a great question. I think, I guess one thing about my job is I'm so humbled by these patients go through so much. You know, they have their cancer and they still have their other life, and, you know, and all of the problems that it's faced there. So I think, you know, there's a slogan around, you know, there's no routine cancer. I think, you know, I really think there's no routine patient. So you could have the best treatment in the world. It could be perfect. It could be a miracle drug. But if that woman has anxiety or has fear or has, you know, financial concerns or responsibilities of raising young children, and those are her priorities, she's not going to get to that treatment. So we have to look at, you know, what are their obstacles, what are their hurdles that they have to face, and help them, whether that be financial assistance, whether that be giving them rides to care or child care or counseling, you know, helping them through support groups. Those kind of things are really important, and I think equally important to the treatment that we offer, you know, from a medical perspective.
Doctor, anything in the pike in the near future that you see happening in breast cancer treatment and research?
I think just more individualization of care. So really taking, just like you and I have our own DNA, each cancer does. So kind of profiling that DNA of a woman's cancer and finding what mutations might be there that we could target with specific drugs, or we could lessen treatment and really individualize the care. So again, more effective and less toxic treatment can be offered.
Absolutely. All right. It is so good to see that things are happening. You know, we always say all this money going to research and what's happening, and there are actual advancements every single day. And at Zangmeister Cancer Center, of course, you guys on the front edge of all of that. So, Dr. Knoble, thank you so much for being with me.
Thank you so much for having me.